Hi, my name is Yongxin Wei from UTS. I'm like most of you, currently a junior student who is about to graduate. When you are watching this presentation, you may be faced with the fear of future of unknown. Well, don't worry. Today, I'm going to introduce you something big. If you can handle this perfectly, you should be more confident in yourself. Yes, this big guy named Code Blue. This presentation will introduce the background of Code Blue in hospital and some effective leadership skills, as well as the nursing expectation as a new grad. So what Code Blue actually is, according to the Rosix article, Code Blue can also be referred as a medical emergency resuscitation event. This is an announcement in the hospital when the patient's heart has stopped, so cardiac arrest, or when they have stopped breathing, respiratory arrest, requiring a team of members to flow into a room to begin immediate resuscitate effort. The goal is to bring someone back to life. Now let's dig into the detail. Why is Code Blue in hospital a problem? When the Code Blue happens, this might mean that a patient is unresponsive, no respiration, no pulse. Patient safety is a big problem. The article Journals of Nursing reports that there are some factors that might pose a threat to the safety of the patient. Poor training for the code, poor role clarity and communication, issue with crash car, inadequate equipment, issue with elevators or stairs. Like if the elevator is too crowded and busy, which delay the best first at time. Issue with phones. Like there's no phone allocated in elevators hallways, which can't communicate with others on time. Familiarity with the building. For example, the facility need larger and more friendly maps to guide core team to the first scene. Healthy workplace is another issue here. When the team are saving people's lives, are they safe? Is hospital setting create a healthy environment for everyone around and involved in Code Blue? Physical environment needs to be safe, such as the floor needs to be dry, prevent the code team from slipping when emergency happen. Equipment safety needs to be considered. For example, when the physicians inject medication to the patient, the needle should go straight into the sharp bin. Queensland government established that the staff allocation is very important issue contribute to the healthy workplace. The staff should be allocated equally and adequate in every ward, which will prevent short of staff when the Code Blue happened. The patient around will be very panicked. Close the curtain and doors for them. Appears their emotions are necessary. So again, only a reasonable staff allocations can prevent unnecessary injury and trouble. Today, CPR is one of the most common interventions in the world. About 30% to 40% of hospitalized patients fear to survive from undergoing CPR, which indicate the low survival rate. So how to improve patient survival rate is an issue to nursing practice. The next slide will show you what are some effective procedures when we deal with Code Blue in hospital. According to the Department of Health, DRS ABCD Action Plan is commonly utilized as a guide for the initial management of a casualty requiring first aid. The first step is D for danger. It's all about ensuring the area is safe for everyone at the scene. In the hospital setting, nurses need to move the obstacles around the patient, such as bedside table, curtains, to create a big space to do CPR. R is for response. To check for a response, start verbally by asking questions and then cautiously approach the casualty to squeeze shoulders. The next step is S for send for help. In the hospital setting, send for help can be done by asking the other nurses around you for help or pressing the blue button at the bedside. The call will be resounded from all over the world. A for airway. Nurses need to check airway for obstructions. This stops any obstruction from traveling further down the airway. If an obstruction is found, roll casualty into the recovery position and remove foreign objects. B for breathing. Always check breathing by looking, listening, feeling to make sure chest is raising and falling. Remember to tilt the head back to ensure an open airway. C for CPR. Perform CPR if there is no response, no movement, and no breathing. CPR generally involves giving 30 compressions and administering 2 breaths. D for defibrillator. Applying defibrillator as soon as it is available and follow voice prompts. This slide will show you how effective leadership resolve the problem of cold blue. Firstly, you need to be confident, be calm, loud, clear. In order to help the patient, you will need to get control of yourself, the cold team, and the environment. When you run into a cold, you must be quickly assessing the situation and establish management priority addressing the physiologic target which lie at the heart of every cardiac resuscitation. Think out loud to the other team member present so they understand the plan. Delegation is essential to effective co-leadership in order to maintain perspective. It's important that you not get drawn into performing tasks during the cold. The co-leader should not perform CPR push, medication, or manage the airway. These actions will draw your attention away from the big picture and inhibit your ability to communicate. Establish the key components of your resuscitation team with any providers available. So, communication is the key. Providers should identify themselves and roles. Management priorities need to clear. Speak clearly and directly. Make eye contact when it's possible. Establish closed-loop communication. And create a shared mental model of the case by summarizing and thinking out loud. As a new nurse, you are responsible for patient care. You require special skills and knowledge and decision-making skills when you deal with cold blue. Noticing immediately of changes in patient's condition. Repeat response team can be called as soon as you identify changes in patient's condition. Determine unresponsiveness. Call out for help. Push cold blue button at the head of bed. Prior to the cold team arriving, start CPR. Defibrillations. Obtain the crash cart. Remove extra furniture from the room. Once the cold team arrives, you do not stop CPR. Do things team leader asked you to do. If the team doesn't need you, go help with patient's family. There are some legal and ethical issues involving the cold blue. According to the ARC, documentation is everything. It's difficult to prove that adequate care was provided if the documentation doesn't exist. When patient outcomes are unfavorable, that risk increases. The cold blue record must be signed by the co-leader. This is only legal valid under those circumstances. In the most ethical case, the CPR provider seeks to protect the patient from harm by making decisions for the patient. According to the article Nursing Management, nurses should act the way to meet the best of patient's interest. Autonomy needs to be provided. The nurses need to ask patients or their family members willing before performing CPR. In conclusion, we need to raise our concern about how we can do to improve the outcomes in cold blue. In addition, as a new grad, you need to fully educate it and train it, be knowledgeable about the ethical and legal boundary. I hope all of you can successfully go through your new grad year and become a true leader one day in your career.